Hey guys, it's MedHub, and welcome back to the channel. Today we're diving into a topic that's critically important to understand: the general management of poisoning. We all know how scary and overwhelming it can be when someone's been exposed to a harmful substance, but having a clear plan of action can make all the difference. Whether you're a concerned friend, a family member, or just someone who wants to be prepared, this video will equip you with the knowledge you need to act fast and potentially save a life. We'll be going step by step through the essential procedures for stabilizing a patient, minimizing the effects of the poison, and ensuring the best possible outcome. So let's get started. Alright, so the first thing you need to do when you encounter a potential poisoning situation is to stay calm. It's natural to feel panicked, but taking a deep breath and approaching the situation systematically is crucial. Start by assessing the scene. Is it safe for you to approach? Make sure there are no immediate dangers to you before you proceed. If the scene is safe, check the patient's responsiveness. Are they conscious? Are they breathing? Next, call 911 or your local emergency number immediately. Every second counts in a poisoning emergency, and getting professional help on the way is absolutely vital. While you're waiting for the paramedics to arrive, focus on the ABCs: airway, breathing, and circulation. Make sure their airway is clear and that they're breathing adequately. If they're not breathing or their breathing is shallow, start CPR if you're trained to do so. Finally, check their pulse and blood pressure and look for any signs of shock. Keep talking to the patient, even if they're unconscious. This can help you monitor their level of consciousness and provide reassurance. Once the paramedics arrive and have taken over the patient's care, they'll likely begin the decontamination process. This involves removing or neutralizing any remaining poison in or on the patient. One common method is gastric lavage, often called pumping the stomach. This involves inserting a tube through the mouth and into the stomach to wash out the contents. This is typically done only if the poisoning occurred within an hour of ingestion. Another method is administering activated charcoal. This works by binding to the poison in the stomach and intestines, preventing its absorption into the bloodstream. It's most effective within the first hour after ingestion, but can still be helpful in some cases even later. In cases where someone has ingested sustained release or enteric-coated drugs, which release slowly over time, a procedure called whole bowel irrigation might be necessary. This involves flushing the entire digestive system with a special solution to clear out the medication. With decontamination underway, the focus shifts to providing supportive care to keep the patient stable and manage any symptoms they're experiencing. One of the most important aspects of supportive care is maintaining the patient's hydration and electrolyte balance. This is typically done through intravenous fluids, which deliver fluids and essential electrolytes directly into the bloodstream. Depending on the specific poison involved, there might be specific antidotes available that can help reverse its effects. Antidotes work by counteracting the poison's actions in the body. In addition to addressing the immediate effects of the poison, it's crucial to manage any symptoms the patient might be experiencing. This can include anything from seizures and pain to agitation and hallucinations. Poisoning can have long-lasting effects, so ongoing monitoring and follow-up care are essential for a full recovery. Even if the patient seems stable, it's crucial to keep a close eye on their vital signs. This includes their heart rate, blood pressure, respiratory rate, and oxygen levels. Any sudden changes in these vital signs could indicate a worsening condition. Additionally, regular blood tests will likely be conducted to check for organ function and monitor the levels of the poison in the bloodstream. These tests provide valuable information about the patient's progress and help guide treatment decisions. In cases of intentional poisoning, it's essential to address the underlying mental health concerns that led to the incident. A psychiatric evaluation can help identify any mental health conditions that require treatment and provide support and resources for the patient. Preventing poisoning is always better than having to treat it. That's why education is so important. Once the immediate crisis has passed, it's essential to take steps to prevent future poisoning incidents. Start by educating the patient and their family about the dangers of the specific poison involved. This includes information about its potential effects, safe storage practices, and what to do in case of accidental exposure. Next, implement safety measures in the home, especially if there are children present. This includes storing medications, cleaning products, and other potentially toxic substances out of reach, in locked cabinets and properly labeled. Finally, remember that prevention is an ongoing process. Stay informed about common household poisons, keep emergency numbers readily available, and be prepared to act quickly if an accident occurs. Thank you for watching. Remember, quick and effective management can save lives in poisoning emergencies. Knowing the steps to take can make all the difference in those critical moments. If you ever find yourself in a situation where someone might be poisoned, don't hesitate to act. Stay calm, call for help, and remember the information we've covered today. Stay informed and stay safe.